I'd like to demonstrate several ways to package slides. As you know, if they're received shattered or broken, it makes it really challenging to manage the case. So here you can tell one of the slide boxes in this particular case is an open with the side. You can see that I'm putting just small pieces of foam immediately on top of the slides, and when you bring it down you can tell that when you move it there's no sound. So sealing it with a piece of masking tape like this just means the person, when they open it, is not going to have any trouble and can use it again. A different area, this is just with a little bubble wrap used in this particular slide. Again, you don't hear anything, and putting on a masking tape over it as well, tightly held down, will mean that the lid will not open. Finally, one of the more common carriers, if you put it in really tight like that, you'll notice there's no shaking and no ability for the slides to move. But importantly, the foam will allow it to keep from shattering if for some reason it opens later on. So these three can now be put in with a piece of bubble wrap like this. I'm just casually putting it together. I'm going to tie it with masking tape again just to give it a seal, and you'll notice that I'm including the opposite side in this particular case so that you've sealed that particular portion of the tissue as well. I put it in a plastic bag, and the reason for this is if it opens during transit, at least you're not going to have the slides getting wet and sealing the container, obviously in a biohazard material. This is the paperwork, and you will notice it goes nicely into the container, which you then seal, and now you have a flat envelope.